Hi everyone, I'm Dr. Megan Dowling, and thanks for tuning in to my Healthy Families Facebook Live video series, where I'm dedicated to bringing you important, research-based, unbiased information to help keep you and your families happy and healthy. So after last week's video about prenatal vitamins, I had a few people contact me about natural treatment options for children with ear infections. And this I felt was a great topic to talk about because unfortunately, they're so common. 5 out of every 6 child will have an ear infection by their 3rd birthday. And in fact, ear infections are the most common reason to visit a pediatrician. So signs of an ear infection include obviously ear pain. Your child, if they can't talk yet, might be pulling on their ear. There's going to be a fever, possibly. Drainage may be coming from the ear. The ear could be red and swollen and hot to the touch. Sometimes their cheek on the same side of the infection may be red. And obviously they're going to be irritated. They probably can't sleep very well, and they're going to be crying a lot more because they're in a lot of pain. And when you take your child into the pediatrician, the common treatment for ear infections is antibiotics. And this is, even though antibiotic treatment of ear infections has been well documented, that they do not shorten the course of the ear infection. And because of these findings, the American Academy of Pediatrics created new guidelines in 2013 that advise doctors to watch and wait when it comes to ear infections rather than prescribe antibiotics. And this is especially important for children between the ages of 6 months to 2 years of age. And so they suggested this not only because of antibiotics' ineffectiveness and also the fact that overuse of antibiotics leads to antibiotic resistance, but also because antibiotics that are unnecessary, especially in young children, can be detrimental to their health because they kill off the good bacteria within their gut. And this can lead them to be more susceptible to things like more ear infections and food intolerances and sensitivities, vitamin and mineral deficiencies, and even things like autism, ADD, and behavioral issues, since there is a known link between our gut health and the gut bacteria that reside there and the risk for developing these neurodevelopmental conditions. So another treatment that's often recommended at the pediatrician's office is to give your child Tylenol for the pain of the ear infection. But unfortunately, studies such as the one that was recently published in the European Journal of Public Health found that Tylenol use in children has been linked to increasing the risk of many health issues. For example, they found a 60% increase in the development of asthma in children who had even just a single dose of Tylenol within their first year of life. Next week, I've decided I'm going to be talking about the negative effects of Tylenol because I feel it is something that every parent should know about. So because of these negative side effects of the conventional treatment for ear infections, many parents are looking for natural treatment and remedies for ear infections. So the first suggestion I have for you to naturally treat an ear infection is to get your child adjusted. And I'm a chiropractor. Of course I'm going to recommend that, but it's true. I can't tell you how many times I have adjusted a child with an active ear infection and their parents have either called me back later that day or texted me early the next day to tell me that the ear infection is gone and their child finally slept through the night. So if you have this works because of misalignments that might be there in the cervical spine, and they could be putting pressure on the structures within the inner ear and the eustachian tube, and that pressure can build up within the middle ear and contribute to the pain of the ear infection. So take your child to the chiropractor first thing if you notice an ear infection. And if you have any questions about pediatric chiropractic, then check back in my other videos that I've done. I've just did one recently on taking your child to the chiropractor. And the second suggestion I have for you is to remove dairy from your child's diet. So dairy is mucus forming, and this promotes the growth of the bad bacteria within the middle ear. And it also prevents your immune system from fighting the infection. So removing dairy can be an effective short-term solution to an active ear infection, but it also is a very important part of a child who chronically suffers from ear infections. And then another suggestion is to get your child started on some probiotics. And this can help because it can help your child's immune system defeat the bad bacteria within the middle ear. So make sure if you get a probiotic that you get one that's dairy-free and preferably in a powdered form so they can mix it with water or juice, and then have them take the dose in the juice and swish it around in their mouth a little bit. You can even take your finger and put it in the powder for babies and put it up inside their mouth on the back wall of their cheek here, because that's where the opening of the eustachian tube is. And that way some of the probiotics can make their way up the eustachian tube and into the middle ear. And lastly, I suggest that you can try my garlic oil recipe. And this is important because you see your child in pain and you want to do something. And if you know you shouldn't give your child Tylenol, then this might be a very good alternative because it's going to help kill off the bacteria a lot faster. So this recipe, every time I've used this or my patients have used it, it has worked literally within minutes. And you can find garlic ear oils online or even in health food stores, but I find that this homemade recipe works a lot better because I think it has something to do with the fact that the garlic is fresh and the compounds that help kill off bacteria are just a lot more active. So for my kids, my daughter has had 2 ear infections in her life and my son has had 1. They're both active, very symptomatic ear infections. In my daughter's case, her ear turned bright red and she had redness all over the affected side of the cheek and she had a slight fever. And then my son, he had drainage coming from his ear and he was pulling on it and they're clearly in a lot of pain. So what I did, I obviously adjusted them, and then I let them lie down and watch their favorite TV show with the affected ear up. And then I put the garlic oil in their ear, and literally within a 30-minute time frame of their TV show, their ear infection was gone. And that's how effective this treatment is. So I'm going to post the recipe in the comment section below. And the recipe is 2 tablespoons of olive oil, preferably organic, some organic garlic, 2 cloves minced, and also 4 drops of tea tree oil, 2 drops of oregano oil. And you can find the tea tree oil and oregano oil in health food stores like Whole Foods. So you heat the mixture very gently over the stove and then let it cool to room temperature. And at that point, you can put it in like a eyedropper. And as long as the mixture is cool enough, you can drop it into your child's ear as they're lying on their side. And then you leave it in there for 30 minutes. And once the 30 minutes is up, you can put a paper towel over that ear and then have them turn their head so the oil drains out. And then you can do it again if you need to, but I have never had to do it again. So this literally works so quickly and without any of the harmful side effects like Tylenol and antibiotics. So again, I'll post this recipe in the comment section below. So to recap today, if your child gets an ear infection, 1, get them adjusted. 2, take dairy out of their diet. 3, get them started on a probiotic. And 4, try out this garlic oil recipe. I swear, it's a miracle worker. So know that if you take them to the pediatrician, they will more than likely take a watch and wait approach and do nothing, or prescribe them antibiotics that they don't need. That's not going to help them get better any faster. So also stay tuned next week to find out more about the dangers of giving your child Tylenol. So if you know of somebody who could benefit from today's episode, please like this video and share it to your page. And take care. I will see you next week for another Healthy Families episode. Bye now.